a mental condition that causes intellectual abilities that are severely below normal. Learning self-care and the capacity to comport oneself according to societal norms can all be hindered by mental retardation. A permanent condition of defective or unfinished mental development is known as mental retardation. The most common definition of mental retardation states that it must meet all the three of the following criteria: apparent before the age of 18, and concurrent and connected deficits into two or more adaptive skills domain, and significantly sub-average intellectual performance. This is merely an introduction to mental retardation. Let's move on the fact of life, the perspective of mental retardation.
Several research investigations that compare retardates and normals purely based on IQ classification support the idea that mental retardates are the homogeneous group. Comparative studies where mental retardates are characterized as having a position on the evolutionary scale somewhere between monkeys and children of average intelligence are where the idea that mental retardates as a group are different is most vividly met. It is interesting to note that individuals who perform poorly in intelligence tests are frequently referred to as mental defectives rather than mental deficiency.
The views of this intellectual handicap are not very well known. However, some aspects are being addressed in several fields of study. A hereditary disease known as mental retardation is characterized by severely subpar adaptive behavior and general intellectual ability. A multitude of genetic, environmental, or other factors may result in mental retardation. Furthermore, even though mental retardation is a lifelong condition, the majority of those who have it can benefit from comprehensive, individualized programs designed to teach them the adaptive skills they need to increase their level of independence. People who have mental retardation typically have below average intelligence, or mental ability, as well as the lack of skills needed for daily living.
So let us define mental retardation. It is any component of development that is delayed or lacking in someone with a mental impairment. There is a widespread and obvious deficiency in verbal, social, cognitive, and motor development. Limitation in intelligence and adaptive skills are two characteristics of the specific condition of functioning known as mental retardation, which starts in childhood. These are the areas being mentioned. First, intellectual functioning. This relates to a person's capacity to learn, reason, make decisions, and resolve problems. It is also referred to as IQ. Second, adaptive behaviors. These include daily life skills such as efficient communication, involvement with others, and self-care. This prevailing problem is circulating in an estimated 1% of the population suffers from an intellectual disability, or also known as mental retardation. Let's continue to a detailed explanation of mental retardation and its causes and symptoms after learning its definition.
One or more chromosomal abnormalities can occasionally be hereditary cause of mental retardation. Sometimes, however, issues during pregnancy that have an impact on the embryonic brain and central nervous system might lead to mental retardation. If pregnant moms do not obtain the right nutrition and medical treatment, if they become ill during pregnancy or childbirth, if they use drugs or alcohol, or if they are exposed to chemical in environment, then their babies may be born with mental retardation. Although there are many diverse causes of mental retardation, it is frequently impossible to identify a particular cause for a particular person. Cause of mental retardation, genetic condition, and prenatal problems. In genetic condition, mental retardation occurs as a result of several single gene diseases. A parent may pass on some chromosomal defects to the children. While in prenatal problems, when the fetus does not grow normally inside the mother, it may lead to mental impairment. Perinatal problems during labor, severe prematurity, very low birth weight, birth asphyxia, difficult and complicated delivery, birth trauma, during late pregnancy, complications of pregnancy, diseases in the mothers such as heart and kidney disease, diabetes, and placental dysfunction, and during neonatal first 4 weeks of life. Postnatal problems in infancy and childhood. Infant and kid postnatal issues are included. It involves bacterial meningitis and other brain infections, including TB. Furthermore, head damage, extended exposure to lead, extreme undernutrition, and grave understimulation. Metabolic disorders. Mental retardation might also result from metabolic problems.
Many illnesses known as mitochondrial cell diseases can now be identified thanks to molecular medicine. Exposure to certain types of disease or toxins, if medical attention is postponed or emphysema, illnesses like whooping cough, measles, or meningitis can result in mental damage. Mental ability may also be impacted by exposure to toxins like lead or mercury. Iodine deficiency or cretinism, the most prevalent preventable cause of mental disability in parts of the poor world where iodine deficiency is rampant is iodine insufficiency, which affects about 2 billion people globally. Goiter is also brought on by iodine deficiency, and the quiet iodine supply from the mother limits the development of the fetus brain, which causes hypothyroidism. Mild intelligence impairment is more typical than full-fledged cretinism, the term used to describe retardation brought on by severe iodine deficiency. Malnutrition, reduced IQ, is frequently caused by malnutrition in famine-stricken regions of the world.
We should now refer to it as intellectual disability or intellectual developmental disorder instead of mental retardation. It is preferable to use the term individual intellectual disability rather than mentally retarded. When you are around them, you need to act naturally and consider how you present yourself both to yourself and to others. By treating them like regular people, you'll make them pleased and gain their trust by working together in projects. Observe their restrictions. Occasionally, they might behave like children, and there's a good chance that they won't be able to manage it since they believe you are disregarding some standards. Bullying occurs 2 to 3 times more frequently against children with disabilities than against their peers without impairment. They want to live their lives just like we do, but unlike us, they have a lot of difficulties doing so because they are less intelligent and lack fundamental life skills. Knowing that there are ill-mannered individuals who have the audacity to make fun or harm the sentiments of those people is incredibly upsetting and in no way acceptable. They are trying, so please be kind to them. Give them your support and never let them feel like they don't belong here.